Hi, I'm Dr. Lucy Meyer from Third Coast Foot and Ankle, and today I'm going to discuss with you what you need to change about your lifestyle if you're dealing with a neuroma. Now, granted, we don't want to change our lifestyle ever. We are very comfortable with who we are, right? But there are situations where we can make some mild changes to the way we do things or what we wear that can make a big impact if we're struggling from a Morton's neuroma. Now, a Morton's neuroma is pain underneath the ball of your foot that's being caused by a nerve that's getting pinched. So it's really important to think about the shoes that you are wearing, and specifically make sure that you're wearing very wide shoes. Wide shoes to the point where you can feel like you're wiggling your toes inside of your shoe. Now, if you are a professional that needs to wear dress shoes, this obviously causes some difficulty, but there is a plethora of shoe options out there, and I think this is one of the most important things to consider. Now, if you're having difficulty finding a wide enough shoe, there are also alterations we can make with the shoes, and I recommend everybody who has a neuroma use an orthotic, because the padding that we use for neuromas and orthotics is extremely effective at preventing overloading and pressure on that nerve. Now, there are some things that I really recommend us avoiding, and that is any repetitive trauma to the ball of our foot. And so I think the best example to get everybody's mind in the right place is thinking about sprinting. Like if you are running as fast as you can, your foot is the pressure is on the ball of your foot. You're leaning very far forward and your heel almost never touches the ground. And that's just repetitively slapping on this area where we have the nerve. Now, for most of us who get Morton's neuroma, it is not in our sprinting years. Now, if you're a sprinter, wonderful, but most of us are runners that are looking for more distance or cardio exercise. And so we have to think about our form. We want to make sure that we're not having form where we're actually staying on the ball of our foot when it's not necessary to. If you're not sprinting, you do not need to be using that form. And so if you are a runner and you want to stay a runner and you have a neuroma, you need to think very strategically about your form. And I would recommend getting with a physical therapist that can actually coach you on this. There are also shoe options that can help change your form, but also change that pressure dynamic across the ball of your foot, such as a low pitch or a low heel drop. So there are plenty of brands out there now that offer these low drops, which is meant to take the pressure away from the ball of your foot. Now, there are also just like silly things like, running upstairs. Certain types of hiking are going to be a little bit more uncomfortable. Certain yoga poses are going to put a lot of pressure on the ball of your foot. It's not necessary for you to stop all of those activities. You just have to be very cognizant of when you're overdoing it and maybe make some modifications or make some alterations in your trails or your routes when you are trying to do some of these activities to give that part of your foot a break. And then obviously combine it with the appropriate orthotic and shoe to alleviate that pain. So if you are struggling with a neuroma and you're also struggling trying to do your lifestyle with that neuroma and want some more specific coaching on how to live with your neuroma comfortably while doing the activities that you love, please reach out to us here at Third Coast Foot and Ankle. I love having these discussions with my patients, keeping you feeling good, doing the things that you want to do, and getting over these pesky little foot problems. So if you found this video helpful, please like and share. That helps us out immensely. But if you have more questions, we want to help you. So call Third Coast Foot and Ankle and we'll get you on the road to recovery.